Hello, I'm Dr. Silva, internal medicine specialist. I'm one of the doctors here at New Path Ibogaine. I personally have over 13 years experience in Ibogaine treatments, and today we're gonna answer the internet's most frequently asked questions about Ibogaine. Short answer, yes. Ibogaine treatment is safe when it is done under experienced medical supervision. You need to have doctors, nurses that are ACLS trained. You need to have the appropriate medical equipment to monitor a patient throughout the treatment course. And you need to have the medications necessary just in case some type of cardiac complication arises. Basically, everybody can potentially be an adequate patient for Ibogaine treatment. But there's a few things that we need to address before a patient is eligible for treatment. That is why when the patient calls in, there is a complete medical history done. We assess any type of medical conditions the patient might have. We analyze a complete lab work, EKG, and if everything is okay as far as all of that, everybody can be treated. Ibogaine can treat various type of addictions. From experience, I can tell you that the greatest beneficial effect that we have seen with Ibogaine treatment is for opiate addiction. But it can also be used to treat alcohol, methamphetamines, cocaine, as well as treat psychological and psychiatric conditions like depression, PTSD, anxiety disorders. Usually what we do is we begin with a test dose of Ibogaine. And that test dose is basically to assess how sensitive the person is to Ibogaine and how much we're going to fluctuate with. Here at New Path Ibogaine, everybody gets dosed individually. There's no standard dose. It all depends on your body weight, on your reaction to the test dose, what you're getting treated for, if it's for a specific type of addiction, if it's for a psychological or psychiatric condition. So all that gets factored in to determine how much we're going to treat you with. Now, once we do begin with the actual flood dose of Ibogaine, there's a couple of phases that you're going to go through. The first phase, which is the dream phase, the hallucination phase, can roughly last between 3 to 7 hours. Then after that, you'll go into the second phase, which is an introspective phase and an analysis phase. It's a longer phase. This phase can last between 12 to 16 hours. So putting those two phases together, Ibogaine treatments can roughly last, like I was saying, between 20 and 24 hours. After that, the acute or intense phase of Ibogaine is pretty much done. And then you'll just go into the final phase, which is recovery phase, which can last between a couple of days to a few days. There are a few side effects that Ibogaine can produce, and some of them can be as mild as just feeling dizzy, lightheaded. Nausea, that's always a guarantee. Almost everybody gets nausea with Ibogaine. A little bit of tremor, a little bit of ataxia, and also there can be more severe complications like different types of cardiac arrhythmias. But that is precisely why patients are monitored throughout the whole course of the treatment. That is why we have experienced ACLS trained personnel, and very importantly, that's why patients are pre-screened, like we were talking before, to make sure that you are an adequate candidate to be treated with Ibogaine. Success rate of Ibogaine treatment is as high as 100% immediately after being flood dosed with Ibogaine, and you see the results immediately. Patients, for example, for opiate addiction, once we begin with the flood dose, pretty much any type of withdrawal symptoms and cravings are pretty much gone by that point. And as well as patients with other addictions. But that is the immediate result. Now, it is much different to see that result than to see a persistent, long-standing result. Obviously, patients, when they go back home, that's when the hard work comes in. But that's also why we have experienced psychologists and personnel to help prepare you to when you go back home, so you can have the adequate tools to go back to your life and not relapse. Because you can leave here clean, but if you go back home, you do not make any modifications as far as your lifestyle, your social circle, and all of that, a lot of the patients do eventually relapse. So you need to be prepared to go back home and put in the work. All your high blood pressure medication, your diabetes medication, any chronic diseases or conditions that you're taking medication for, that does not need to be stopped. Basically, what will stop is any central acting medication like antidepressants, antipsychotics, benzodiazepines, any medication that can potentially interfere with the effect of Ibogaine as far as the dream phase, the hallucination phase. So you can try to get a better experience from that and not have any medication that might interfere with that. Well, I'm Dr. Silva, internal medicine specialist, one of the doctors here at New Path Ibogaine. It was a pleasure answering some of the internet's most frequently asked questions. If you have any other questions that weren't answered, please give us a call or please write to us and we will answer all your questions. We are ready here to assist you and to help you whenever you're ready to come down. Please call us as soon as you can.